Good morning, good afternoon, good evening, whatever time it is, wherever you are. This is Gail of Gaia on Free Range, and I have with me Sterling Hill, and we're going to be going over some of the important points that we've found in our research concerning wearing face masks. It's not the type of protection that people think it is, and we have um, the comments by some experts who actually don't have an agenda like some people do. So, how are you doing, Sterling?
I'm doing great. Can't wait to hear the first one about Judy and what she has to say. That's going to be exciting.
Yes, let
Very
me.
smart lady.
Yeah, okay. I'll read over some of the comments that I don't think Judy needs any introduction to speak of anymore. She's been on just about a ton of shows now already. But for those that don't, she's a very great researcher, well known, and she's been spot on about Lyme disease. Um, what are those other
Well,
abbreviations?
she's a molecular virologist
Oh, okay. Well,
that's worked in level 4 bioweapons facilities and actually under Fauci and Gallo. If you remember, and the band played on. She is amazing. She's one of the most amazing scientists of our era. Hey, Fauci had her manipulating Ebola in one of his labs.
yeah, isn't that's frightening?
Mhm.
That man is frightening.
Very.
Um, and what he did to her is absolutely criminal as well. Um, Not allowing her to tell the truth, expecting her
Mhm.
to lie, and so on. She's a hero of mine as far as I'm concerned. I am so proud of her for what she's done. But anyway, one of the things that she has stated is the pandemic is being misrepresented as if viruses float through the air. Viruses do not float through the air. They don't live on surfaces, especially coronaviruses. They don't are much they might be on a surface as much more than an hour at the best, and we're being told to wipe down our groceries. That's absolutely ridiculous. Okay. It's far more plausible that it's the virus that's been injected. This virus didn't spread to 110 countries from a seafood market in China. It's plausible, it's probable that it's been in the flu vaccine since 2013 and 2015. We have no idea, but the flu vaccine is driving the infections. I object to the mask because if you are carrying these injected viruses and you are wearing a mask and you activate the virus with things like stress, these dormant viruses will wake up in yourself and you will reinfect yourself with the mask. So you're actually putting a stress on your body by wearing the mask, reducing your oxygen levels. It also reduces T lymphocyte levels too, I read recently. And all of that is interfering with your immune system in a very negative way. So people, especially with those with asthma, COPD, or those living in a very polluted area, there are a lot of cofactors to disease development, and this is Judy speaking here. Wearing a mask will kill more people than the virus. Should I read that again, people? This is an expert microbiologist and virologist. Wearing a mask will kill more people than this virus. It is the vaccinated that are spreading the virus because they are immunocompromised and they don't even know it. The more you get vaccinated, the more you've gotten the flu vaccine, the greater your risk. You put on that mask and you're lowering your immune system. You can be activating viruses you didn't even know you had. And then they're going to blame it on you know people that didn't wear masks, just like they try to blame unvaccinated people for being a risk to vaccinated people. Well, if your vaccination works, why would you be afraid? It's going to be the same thing with the mask. Wouldn't you agree, Sterling?
Yeah, I totally agree. This is insane. And to know Judy personally and all of what she went through to get the truth out to people, and she lost everything, her career, her money, everything but her home and her husband. You know, she had to file bankruptcy. It could never work again. And,
Absolutely criminal.
the day before she was going to publish her paper where she found the pulverized mouse brain containing the XMRV virus that was shot up in so many people, it affected so many people, the XMRV was the cause of lupus, autism, 40 cancers,
Wow.
3 leukemias, chronic fatigue syndrome. When she was about to publish that paper, the day before, Fauci called her up and said, if you publish that paper and you're arrested, she was going to tell the truth.
Isn't that's that's very emotionally upsetting to know that people face this kind of thing when they're telling the truth. And I know she did. And like I said, that's why she's a hero of mine. Let me read this little bit about Judy for those that may not know. She was a lead scientist working on behalf of the US government with viruses and infectious diseases. She discovered that animal cells routinely placed in vaccines were implicated in rapid cancer growth and spread, and other disease genesis as well. As she reported her findings, the US government fired her and tried to bury her research. She kept her material, published several books, and routinely tries to warn the public that what they're being told about vaccines, viruses, and other related issues is coming from a corrupt government system, which doesn't have the public's best interest at heart. It's hard for people to believe that, but it's very true. I've found that in my own profession in the past as a dietitian, just by listening to what the leaders of the organization were saying, that were supposed to be in the best interest of the public health, and they were not. And that was about GMOs, that was about chemicals in food, and that was about eating at fast food restaurants, and the hormones that they were going to add to milk as well. So I have seen it before, and it's not hard for me to believe what they did to Judy. And it's just that we as a public must become more aware and critically think about these things that they're telling us, because there frequently is an agenda behind it. Thank God there are people that have the guts to stand up and tell the truth in spite of what might happen to them. They stand in their light, and I'm proud of them. So we have another one. Would you like to talk about James Lyon Weiler?
Yeah, I'll talk about James Lyons Weiler. He is a very brilliant man. He's a friend of mine as well, with his Judy. So Dr. Lyons Weiler is a longtime veteran in the areas of genomics, proteomics, bioinformatics, and evolutionary biology. He earned a PhD in ecology, evolution, and conservation biology, and won a US DOE Sloan postdoctoral in computational molecular biology at Pennsylvania State University under the mentorship of Drs. Webb Miller, Masatoshi Nai, and he has served as a faculty senior research scientist and scientific director in support of transitional research, systems biology, sequence analysis, and the creation of novel algorithmic solutions for the analysis of complex and challenging data. He is author of 3 books, Ebola and An Evolving Story, Cures versus Profit, Success in Transition
You're breaking up a little bit, Sterling.
Okay, am I better now?
Yeah, it's
Okay,
probably interference because of what we're
yeah,
talking about.
all
But
right,
anyway, go on.
okay. The
Seems to be okay.
specialties are developmental disorders, including but not limited to autism, autism spectrum disorder, biomarker development for complex disorders, immunology, toxicology, cancer biology, leadership, collaborative science, integrated translational biomedical research, cancer receptors based biomarker development, microarray data analysis, proteomic data analysis, machine learning based prediction model optimization, and information theory. And before I tell you what he says about the mask, I'd like to say, we need to, we're probably going to have to do it on BitChute, but we're going to get Judy and we're going to get James.
Yeah, that would be
And
wonderful.
yeah, we're going to get them,
Yeah,
but those will have to be, this video actually might have to be BitChute, by the way.
yes, indeed. I get that.
So, yeah. So, all right, this is what James puts it out so simple for people to remember this. 30, that's the number to remember. The pores on the N95 masks are 30 times larger than the virus. When someone challenges you, ask them if they know why the number 30 matters to them. Then educate. Stay calm. They are programmed to be scared. Have compassion. All right, he laid it out so simply. So an N95 mask is not even going to stop this virus because the pores on the N95 mask are 30 times larger than what the virus particulate is. So what are they doing?
It's as if they know exactly what they're doing. The people that are wearing the mask and probably are the same people that have been vaccinated before, they're probably activating the viruses by weakening their system from wearing the mask. That's what's really scary.
And it's the cloth masks are even worse. It's a couple famous doctors and scientists came out and said it's like trying to stop a mosquito from going through a chain link fence on the cloth
Exactly. I
masks,
saw
the
that
handmade
cartoon.
ones, and it's like, whoa, I knew this. I said, if anything, all right, so there is a virus, we know, and it is affecting elderly and people with huge comorbidity issues. And those are the same people who die from the flu, but we don't shut down the world for the flu. And,
Hasn't this
here,
year, excuse me, hasn't this year been even less than the average flu year?
yeah, because they're too busy testing it for COVID, and we can go over that if you want,
Well,
because
and
the
then
COVID
those
tests are
tests have
coming
been,
up false positives.
I saw a post that you had posted and I reposted it myself about all it's like you don't know when the test, 1 minute it's positive and the same day it's negative and then it's positive or then it's negative, a couple of negatives and then a positive.
Mm-hmm.
So how can these tests be accurate at all? You wouldn't get very
I know it's just way too much BS. It's I have a post up there where they're telling you they're shaming Trump for within 24 to 48 hours shaming Trump for doing the Oklahoma thing he did.
the rally,
And
yeah.
yeah, and I don't watch too much politics, but I that came across to me. And I'm like, wait, okay, I'm a genetic applications engineer that studies how viruses affect DNA. And I know it takes 5 to 14 days for this particular coronavirus to epigenetically express. And I'm seeing them within 24 to 48 hours. They're like, oh, there's a big outbreak. It must be from Trump coming to Oklahoma. But then in the same sense, I see all these people, like thousands and thousands of people running and sweating and spitting and screaming in protest and rubbing their sweat on one another and stuff. And I'm like,
But
okay.
that's okay, right?
Yeah, that's okay because, and there's actually an article out saying the protests lowered the COVID because more people stayed at home because of the Provet test. I said, you got to be kidding me. This is all a lie and a scam, and there's so much deception. I'm not saying there's not a virus. Okay, we know that. We know that there are some people getting sick. And it's the same people who die from the flu because they have huge comorbidities or they're 80, 90 years old, and we're going to have to be careful around those people. There's something bad out there, and there's also some type of biotoxin, I feel, because of what we saw in Italy, right?
Right, right,
Yeah.
right.
So, there is something bad going on. And, you know, I just I can't get right my head around people believing what's going on in the media right now.
I know, I don't know how anybody believes anything the media says right now, and yet we still have people, well, if they didn't hear it on the news, then they don't believe it. That is such a problem. It's crimes against humanity by the media, straight up. But anyway, I'm appalled by it. Did you hear about how infant deaths have gone down substantially
Yeah, because
because
they're not vaccinating.
exactly. No, the SIDS epidemic has
Yeah,
all of a
it's
sudden
gone.
gone. And that
Disappeared.
should tell you something right there. These
Yeah.
vaccinations and vaccinating, well, I don't know if I should be using that word, but doing it at such a
Well, I don't think we're going to be able to put this on YouTube either. So this
no.
one, you might have to put a little thing up, and we'll put it all over on BitChute for
I'll
you.
put it on BitChute, yeah.
And then you can just do a little thing on YouTube and tell them here, how people put their posts up
Yeah.
now on YouTube.
I'm
So.
sorry, probably shouldn't have been talking so freely about the vaccination at that point, but I was just.
Yeah, this one's already, we don't want your channel taken down. We're going to get a BitChute with this
Yeah,
one. Okay, girl. But you
definitely.
need to get some filler over there.
I just wish that there was something that could be done about this censorship because it is un-American. It's against our First Amendment rights, and we're supposed to.
They've totally ripped apart the Constitution.
Exactly.
The
And, they had already hijacked it in 1871 and now trying to put the original back in it. They're trying to hijack that and destroy it and say it's, horse hockey, so to speak. But it's far from it. It's what it sets the example for the rest of the world of freedom and justice. And we don't have that right now.
No, we don't.
So let's go on with the story about the 26-year-old girl.
Okay, yeah, I'll talk about that one. That's pretty interesting.
Yes, and this isn't the only story that I heard about either. But
no, there are lots, but this one was pretty frightening. And so it's from a mother of a 26-year-old healthy girl. It said, and she says, if you love wearing the mask, then you need to read the story. It's 100% true. And also, I've had a few of my followers, because, I have 12,000 people following me on Facebook, verify. They talk to the mother, this is all real. So apparently, Wednesday on June 10th of this year, at about 3:30 p.m., this mom gets a call from her 26-year-old daughter, who is a shift lead for Walgreens, and her daughter called her and said that she did not feel well and was having trouble breathing. So she went to her doctor's office. The doctor examined her and was shocked to find that she had a collapsed right lung. And this is what really gets me, is the doctor told her to go straight to the ER, and he would call them to be expecting her as soon as she arrived. He should have called an ambulance. This is insane. And then the mom was in complete shock as well. And she heard her daughter crying on the phone and trying to drive herself to the ER. And she had no clue why the doctor didn't call an ambulance. She was saying she couldn't hardly breathe to her mom and was crying. So her mom told her to pull over and call an ambulance. And she got her calmed down, but despite it, mom was freaking out and jumping in her truck to get to the ER, which any mother would do that, right? She thought her mother thought she was now calm enough to make it, so she got off the phone with her. And when her mom got to the hospital, and of course with her husband and their two sons, they couldn't go in. They put her on oxygen for 2 days in the hospital to see if her lung would recover itself, but it did not. After 2 days, they put a chest tube in her. Every time they tried to find out any information, the mom and the father of this 26-year-old, they would not give them any. So their daughter was so medicated, she did not know what was happening or what the doctor even said. And the mother was so alarmed, she contacted an attorney to get medical power of attorney at about 6 p.m. And she walked into the hospital like she owned the place after that and went directly to her daughter's room. She said to keep in mind that she had been there 2.5 days by herself and without any family knowing what the heck was going on and wanted to have this happen and what caused her lung to collapse. And when the mother walked in, she said her daughter was sitting by herself in the dark in a horrible pain because they had just put the chest tube in 6 hours ago and still had not given her anything for pain medicine. And that was due almost 2 hours ago. And then they had brought her food and put on the tray table, but it was out of her reach and she could not move. Plus the tray table's wheels were broken and it wouldn't roll. Her blinds were closed, lights off, no TV. Both trash cans were running over with trash and she couldn't walk or move. So it just frustrated this mother. She saw her daughter sobbing, and when she opened her door, and she saw her stretched out the one arm she could to move to reach out for her, sobbing harder. She said she ran to her and cried and just hugged for a long few minutes. Needless to say, her daughter had pneumothorax, aka collapsed lung, so which can be fatal. And then she said she was glad she asked what the pneumothorax was, and it's a collapsed lung that can be fatal. And what she had found out going to the hospital, because nobody would give them answers until she got the medical power of attorney, that the constant use of her face mask was the reason for this collapsed lung. So when she wore her mask every day for up to 9 hours a day at work and was always extremely busy and breathing hard in her mask from overexerting herself, this is what happened. So when people breathe in oxygen and they breathe out carbon dioxide, then that's when she overexerted herself. She was forcing herself to breathe in heavily and at an increasing rate to do breathing in faster. She was forcing herself to breathe in her own carbon dioxide, which decreased her level of oxygen because of the mask. And it does not allow for fresh oxygen. So therefore, she forced herself into breathing in this carbon dioxide, which the lungs refused to take in. When the lungs refused to take in, it began to push the carbon dioxide in the lining around the outside of her lung. It continued to gather around her lung so much that it had more carbon dioxide around the outside of her lung than the lung itself had oxygen in her lung. Sound familiar, right? That is when the carbon dioxide came so full, it literally collapsed her lung to make more room. So her daughter was in the hospital for 1 week with a chest tube and went through a really difficult time. And she talks about how this can be fatal, yet the CDC, doctors and scientists do not speak anything about this. And her daughter was perfectly healthy and a very hard worker, and it still happened to her. She said, and here's the mother saying this: masks are not meant for healthy people, and they are definitely not for anyone who works hard or exerts themselves. And the mother had said she's researched this and has found other cases as well, yet nobody is talking about it. And she said she respects people and keeps her distance, but after what she saw, she will not be wearing a mask again unless she is sick, and then she'll stay home. This is, this mother is just so upset. She also says that the many doctors and nurses would not have taken their masks off in her daughter's room to talk to them or joke around if it was so dangerous. I mean, they were taking off the mask and the daughters were in, you know? So, you know, we're going to hurt a lot of people, and a lot of people are being hurt. These stories are going over and over and over, and they are ignoring them.
Well, what makes me angry is there are doctors and nurses out there who should be doing their research, and they're just not saying anything because they might lose their job or whatever. Well, when are we going to
Yeah,
unite and tell the truth?
well, because they're order followers, right?
Apparently, even no matter at any cost, when they see patients dying around them
At
or
any
in
cost.
horrible conditions, geez, that's just
Hmm.
pathetic, is what it is. Um, it's
You know, I
very
remember Martin Luther King, you know, himself said, you know, you've got to, even though there's some rules and laws are meant to be broken. I mean, he showed people that.
right. Yeah, and he said
Martin
something
Luther
to
King did.
something. Yeah, exactly, and something to the effect that evil continues when good people refuse to stand up and
Yeah,
when you're
absolutely.
complicit, it's as bad as being an accomplice. Okay, that's the
Hmm.
way I look at it. Okay, we have another famous neurosurgeon expert, and I'm familiar with this particular doctor. I've even had some of his products in the past. It's Dr. Russell Blaylock. He's author of the Blaylock Wellness Report newsletter, and is a nationally recognized board-certified neurosurgeon, health practitioner, author, and lecturer. He attended Louisiana State University School of Medicine and completed his internship and neurological residency at the Medical University of South Carolina. For 26 years, he practiced neurosurgery in addition to having a nutritional practice, which is why I had some of his products. He recently retired from his neurosurgical duties to devote his full attention to nutritional research. My kind of doctor. Okay. Dr. Blaylock has authored 4 books: Excitotoxins, that a good example of that is aspartame or MSG, The Taste That Kills, Health and Nutrition Secrets That Can Save Your Life, Natural Strategies for Cancer Patients, and his most recent work, Cellular and Molecular Biology of Autism Spectrum Disorders. And he says right out the gate, face masks pose serious risks to healthy people by Dr. Blaylock. Let's see what else he says. So you certainly got a good idea of his credentials. We have seen a number of medical practices that have little or no scientific support as regards reducing the spread of this infection. One of these measures is the wearing of facial masks, either a surgical type mask, bandana, or N95 respirator mask. When this pandemic began and we knew little about the virus itself or its epidemiologic behavior, it was assumed that it would behave in terms of spread among communities, like other respiratory viruses. Little has presented itself after intense study of this virus and its behavior to change this perception. This is somewhat of an unusual virus in that for the vast majority of people infected by the virus, one experiences either no illness, which is asymptomatic, or very little sickness. Only a very small number of people are at risk of a potentially serious outcome from the infection, mainly those with underlying serious medical conditions in conjunction with advanced age and frailty, those with immune compromise, compromising conditions, and nursing home patients near the end of their lives. I won't even go there with what happened in New York. There is growing evidence that the treatment protocol issued to treating doctors by the Center for Disease Control and Prevention, the CDC, mainly intubation and use of a ventilator, may have contributed significantly to the high death rate in these select individuals. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, enter the olfactory nerves, and travel into the brain. Think about that one. As for the scientific support for the use of face masks, a recent careful examination of the literature in which 17 of the best studies were analyzed concluded that none of the studies established a conclusive relationship between mask respirator use and protection against influenza infection. Keep in mind, no studies have been done to demonstrate that either a cloth mask or the N95 mask has any effect on the transmission of COVID-19 virus. And that previous doctor that we spoke about, that you spoke about, was talking about the number 30. So if the virus is 30 times larger, how's that going to provide any protection? It's not. Any recommendations, therefore, have to be based on studies of influenza virus transmission. And as you have seen, there is no conclusive evidence of their efficiency in controlling flu virus transmission. Basically, that's all we're dealing with is a flu virus. It's also instructive to know that until recently, the CDC did not recommend wearing a face mask or covering of any kind unless a person was known to be infected, that is, until recently. Now, infected people need not wear a mask. When a person has TB, we have them wear a mask, not the entire community of non-infected. The recommendations by the CDC and the WHO are not based on any studies of this virus and have never been used to contain any other virus, pandemic, or epidemic in history. Now that we have established that, there is no scientific evidence necessitating the wearing of a face mask for prevention. Are there dangers to wearing a face mask, especially for prolonged periods? Several studies have indeed found significant problems with wearing such a mask. This can vary from headaches to increased airway resistance, carbon dioxide accumulation to hypoxia, all the way to serious life-threatening complications like we just spoke of previously, a collapsed lung or pleuritis, both of which are dangerous. There is a difference between the N95 respirator mask and the surgical mask, cloth or paper mask, in terms of side effects. The N95 mask, which filters out 95% of particles with a median diameter greater than 0.3 micro, I don't know how to read that, because it impairs respiratory exchange breathing to a greater degree than a soft mask and is more often associated with headaches. In one such study, researchers surveyed 212 healthcare workers, 47 males and 165 females, asking about the presence of headaches with the N95 mask use, duration of the headache, type of headaches, and if the person had pre-existing headaches. They found that about a third of the workers developed headaches with use of the mask, and most had pre-existing headaches that were worsened by the mask wearing, and 60% required pain medications for relief. As to the cause of the headaches, while straps and pressure from the mask could be causative, the bulk of the evidence points toward hypoxia and hypercapnia as the cause. That is, a reduction in blood oxygenation, which is hypoxia, or an elevation in blood carbon dioxide, hypercapnia. It is known that the N95 mask, if worn for hours, can reduce blood oxygenation as much as 20%, which can lead to a loss of consciousness, as happened to the hapless fellow driving around alone in his car wearing an N95 mask, causing him to pass out and to crash his car and sustain injuries. I am sure that we have several cases of elderly individuals or any person with poor lung function passing out, hitting their head. This, of course, can lead to death. A more recent study involving 159 healthcare workers aged 21 to 35 years of age found that 81% developed headaches from wearing a face mask And well, some had pre-existing headaches that were precipitated by masks. All felt like the headaches affected their work performance. Well, I'm sure when you don't have enough oxygen, you can't think straight. Unfortunately, no one is telling the frail elderly and those with lung diseases such as COPD, emphysema, or pulmonary fibrosis of these dangers when wearing a facial mask of any kind, which can cause a severe worsening of lung function. This also includes lung cancer patients and people having had lung surgery, especially with partial resection or even the removal of a whole lung. While most agree that the N95 mask can cause significant hypoxia and hypercapnia, another study of surgical masks found significant reductions in blood oxygen as well. In this study, researchers examined the blood oxygen levels in 53 surgeons using an oximeter. They measured blood oxygenation before surgery as well as at the end of surgeries. The researchers found that the mask reduced blood oxygen levels significantly. The longer the duration of wearing the mask, the greater the fall in blood oxygen levels. The importance of these findings is that a drop in oxygen levels is associated with an impairment in immunity. Studies have shown that hypoxia can inhibit the type of main immune cells used to fight viral infections called CD4 plus T lymphocyte. This occurs because the hypoxia increases the level of a compound called hypoxia-inducible factor, which inhibits T lymphocytes and stimulates a powerful immune inhibitor cell called the TREGs. This sets the stage for contracting any infection, including COVID-19, and making the consequences of that infection much graver. In essence, your mask may very well put you at an increased risk of infections. Let me read that again. In essence, your mask may very well put you at an increased risk of infections. And if so, having a much worse outcome. People with cancer, especially if the cancer has spread, will be at a further risk from prolonged hypoxia as the cancer grows best in microenvironment that is low in oxygen. Low oxygen also promotes inflammation, which can promote the growth, invasion, and spread of cancers. Repeated episodes of hypoxia has been proposed as a significant factor in atherosclerosis and hence increases all cardiovascular, heart attacks, and cerebrovascular strokes diseases. There is another danger to wearing these masks on a daily basis, especially if worn for several hours. When a person is infected with a respiratory virus, they will expel some of that virus with each breath. If they are wearing a mask, especially an N95 mask or other tightly fitting mask, they will be constantly rebreathing the viruses, raising the concentration of the virus in the lungs and the nasal passages. We know that people who have the worst reactions to coronavirus have the highest concentration of the virus early on, and this leads to the deadly cytokine storm in a selected number. It gets even more frightening. Newer evidence suggests that in some cases, the virus can enter the brain. In most instances, it enters the brain by way of the olfactory nerves, which connect directly with the area of the brain dealing with the recent memory and memory consolidation. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages, enter the olfactory nerves, and travel into the brain. It is evident from this review that there is insufficient evidence that wearing a mask of any kind can have a significant impact in preventing the spread of this virus. The fact that this virus is a relatively benign infection for the vast majority of the population and that most of the at-risk group also survive from an infectious disease and epidemiological standpoint by letting the virus spread through the healthier population, which will reach a herd immunity level rather quickly that will end this pandemic quickly and prevent a return next winter. During this time, we need to protect the at-risk population by avoiding close contact, boosting their immunity with compounds that boost cellular immunity. I love it when they finally get to this level. And in general, care for them. So one should not attack and insult those who have chosen not to wear a mask. As these studies suggest, that is the wise choice to make. He does it. That's a great overview.
Absolutely great. And that really worries me because cancer is exploding right now, and we're going to have all these people with lower oxygen environments, and it's just going to thrive.
You know what's sad about this whole thing that I'm perceiving is that this is known and intentional by those that are promoting it. They are not ignorant of these facts.
Oh no.
They are on board with genocide and getting as many people sick as
well, you hear about since this one can't come on YouTube anyway, we might as well talk about it.
Really?
The coronavirus vaccine, you know, they're like telling everybody, all the seniors, all the immunocompromised, all the soldiers and all the black people should get it first.
They're going to kill the entire military, kill the black people, and kill oh my God, it's just unbelievable. Unbelievable. Diabolical.
Yeah, we need to get Sheila on the show too. You know, now that you're a bit shoot, we can start some ones that you can't put on YouTube. It would be wonderful for you.
Yeah. You think they would destroy my home channel if I put the BitChute up on Facebook? Well, I guess I'll just leave it a BitChute. You can still post it. Yeah. I don't know.
It'll just leave it at BitChute. Yeah.
Yeah, probably.
You know, but you can just yeah. But guys, we gotta wake. I know it's hard, but we gotta just slowly plant those seeds in people, because these people they're brainwashed, they're mind controlled. Even Dr. Russell Blaylock basically says that, and Dr. Weiler, James Lyons Weiler, you know, they're saying, even Judy has told me this, Judy Mikovits, hey, they're brainwashed. Okay, you know, we got to take it easy on them. It's hard for us at times. It gets frustrating, but slowly just plant this seeds, you know, like, you know, maybe if you're having a barbecue or something and you see somebody wearing the mask out there, and say, hey, yeah, you trying to keep that mosquito out that chain link fence, aren't you? You know?
Yeah.
You know,
remember that 30.
and then they'll be like, what are you talking about? Well, what do you think about the number 30? Well, did you know that the cloth on there is 30 times, the pores on that mask is 30 times larger than the virus? That means the virus still gets through, you know? And then you plant a seed that way, and then just leave it at that and say, okay, now go have a beer. You know?
Yeah, really. Well, people don't realize how sick they get. You know, I feel sorry for these young people that are working these fast food places or these different stores, and they're requiring them to wear a mask. And some of them even have the audacity to be paying them extra for wearing the mask without giving them any warning about.
Yeah, we'll pay you to kill you, choke you. You know, and then
they should be liable.
I try not to say this as much, because they're trying to make us say the word "I can't breathe" more and more, because, you know, words are magic, you know, to kind of reduce the oxygen around.
It is.
Train yourselves that you can't. So energy clearing, you know, which I would like to teach a little show on energy clearing to different people.
We'll do something on that. Yeah. And we'll bring some of these. We'll bring some of these people like Judy on eventually here. I know she's been very busy interviewing with a lot of people that have a lot more people on their channel than I do, but we all have small little audiences, and just keep informing people. That's all we can do.
Oh, you're breaking out a little bit. Breaking out.
I know. I think
you're right on your end now. It says Gail of Gaia is right.
Well, I think we probably.
I think they're interfering with us.
Oh, they are. They are, definitely. I heard that Zoom has security issues, so that could be part of it.
You heard what happened on my Zoom meeting. You heard what happened on my Zoom meeting, right?
No, what happened? No, maybe I missed that one.
We'll talk offline and see
Okay,
about
okay. All right, that figures. All right, yeah, they're watching both of
it.
us. There's no doubt about that. But
Mhm.
I stand in my light and I stand in my truth, and I'm here to serve, and so are you. Do you have
Yeah,
anything?
we're just guys. I know many of you out there because the ones that follow us and listen to us are awake, and I know it is so hard. But try to keep patient because these people are brainwashed. They're totally. It's like the invasion of the body snatchers has happened. So be patient with these people. I know I've got to practice what I preach as well because I quite often get frustrated too. Um,
Yeah, I do too.
and
It's hard not to. You try to wonder, well, why am I awake to this, and why are you so blind to it? It
I
just makes you
believe that
wonder.
there's some type of you know energy frequency around us that we have this kind of barrier that almost hard to be penetrated.
I think so.
Something protective with DNA, and I think that's why they're wanting to come in with the hydrogel.
Yeah, I would
Yeah,
agree with you on that. Yeah.
so they can
Um,
come and get us, not over my dead body. That's just the way
exactly.
it is.
Exactly. And there's no way
And
that you're
no,
going to vaccinate me.
no, I don't want that in my temple.
Nope. My body temple is mine, and I
Yeah, it
refuse.
belongs to me, not the government.
Exactly. And I don't agree with what they're doing. And I know there are too many nefarious ones that are involved in depopulation. And it's so hard for people to believe that there are deep state doctors or deep state nurses, there are deep state military. We're dealing with them in every profession,
Oh
everywhere.
yeah, absolutely,
So
absolutely.
that's why we got to encourage critical thinking. Try to get people away from their TVs because that's where they get
Oh,
programmed.
oh, that's just, oh man.
But anyway,
I know.
um,
I don't think I've actually watched a news channel. Like I'll watch it sometimes on YouTube's
mhm.
clips or
Clips, yeah,
clips people
at
send
best.
me. But
Yeah,
yeah. But I can't. One of the things is because of the commercials. It's this drug, your leg might fall off, or take this vaccine. You won't die. You know.
yeah.
That's I
So
can't
many
watch that
lives
stuff.
have, so many lies have been perpetrated to us over the years, thinking that putting trust and faith in people that you expect to be able to trust and think that they're being honest, and then we find out later that they have an agenda and they really don't care.
There are dark forces here, and there are light forces here. We're the light forces. The dark
Exactly.
ones are many of them have this fake stuff they call money, um, and
And they
everything's
manipulate people with
collapsing.
it.
We win in the end. We win
We
on
win.
this one.
Yep,
Yeah,
we win.
just always put it out there. We won. We've
We
already
win.
won.
We already
Yep.
won. It's just a matter of time.
Hmm.
It takes time to clean up the big mess.
I mean, this is why you're seeing everything you're seeing right now because they've lost control because we're winning and we've won this. It's already been written. We won. That's it.
Yippee ki
Gotta let it play out.
It reminds me of riding a
Yeah.
horse, throwing your head up. Yeah.
And we were honored enough to be sent here and awake to be able to help, facilitate and be there for the people that are going to have to be just basically slapped awake. Eventually, it's going to be like a 2x4 upside their head.
Yeah.
So,
Yeah, it's going to be hard because it's going to
yeah,
hit them
we've got a hard
hard because,
job, but amazing that
yeah,
we were sent here for that job.
yes. It's an honor to be here,
It's an
to
honor.
serve.
Yes.
Thank you, everyone. Thank you, audience. I hope you enjoyed our talk, and I think we'll bring it to a close for now, and I will upload this on BitChute.
Yeah, this one can't go on YouTube.
Okay. Thank you. Thank you so much, Sterling. It's always a
You're so
pleasure.
welcome.
and we'll be back.